Welcome back, Facebook friends. I have been away last week. I was not on the air, but many of you tried to reach out to me to ask what was wrong. Actually, nothing was wrong. I got busy trying to record for my new series of Get Healthy with Dr. Cooper TV show. But thank you so much for your concern. And I want to welcome all those that are watching me from the United States and from other parts of the world. Thank you so much for following me. The idea for this live is really to educate you on how to live a healthier lifestyle so you can improve, reverse, and prevent diseases. And as many of you have already heard, I've had so many patients that have changed their lifestyles. Some of those patients have been on the show. And I have done that. I've brought them on the show for you to realize that there is always hope and that you can do the same. You know, in the world, we have over 450 million people with diabetes. We have 17.7 million people dying every year from heart disease or cardiovascular disease. This doesn't really have to happen. And that is why I'm here to educate you. Now, if you really believe that the information that you're receiving is really vital, what I'd like you to do is to like and share. Share with your friends so they too can get this information. You know, last week I got a message via Messenger from someone that I don't know, and the person wanted to know if I had any videos on prostate cancer. And of course, I was very happy to send an attachment or a link to my Facebook Live on prostate cancer. So that is what I'm here for. My name is Dr. Cooper-Dockery. I'm board certified in internal medicine, and I have been practicing medicine for the last maybe 27 years or so. And I live right here in the Rio Grande Valley. I know you're watching me from all over the world. So I live in South Texas, way down south, just on top of Mexico. And most people here in the Rio Grande Valley speak Spanish. So of course, I do speak some Spanish. So if you're living locally, I just launched my new Get Health with Dr. Cooper in Espanol, in Spanish. And that airs every Sunday morning at 9 a.m. on Telemundo 40. Now, if you're living anywhere outside of South Texas, you can watch the show. How can you do so? Well, Telemundo has an app. You can download the app, and that's Telemundo 40, and you'll be able to see my television show in Espanol. Therefore, if you have relatives that speak Spanish, just tell them, download the Telemundo app, and you'll be able to see Dr. Cooper's show. Because remember, the show is very informative. As a matter of fact, I did a show on fatty liver a couple of weeks ago. And a new patient walked into my office, and the patient said, Dr. Cooper, I think I probably have fatty liver, and I listened to the show, and I wanted to be checked. So that is the importance of giving you the information. Information on general disease, chronic diseases that are preventable, information on how to eat healthier, how to make wise choices, because really you are what you eat. The food that you consume could either be your medicine or it could be your #1 disease-causing agent. So I know there's so many people trying to understand how to change lifestyle. What should I eat? Should I exercise? How should I manage my stress? And that is what we're here to do. We take a holistic approach to health. That is, we discuss nutrition, exercise, stress management. I'll discuss with you other aspects of health, like sleeping. Sleeping adequately can prevent high blood pressure, diabetes, Alzheimer's, and depression. You know, did you know that if you get enough sunlight, for example, you can increase your serotonin level, that is your happy hormone, and then decrease depression. So there's so many things you can do to improve your health or prevent diseases, even to get off some of your medication. So I want to welcome you again to Get Healthy with Dr. Cooper. And I want you to send my link to your friends and relatives. Ask them to tune in every Sunday at 6 p.m. Central or 7 p.m. Eastern Standard Time to just be educated on lifestyle. Now, in the Rio Grande Valley, I want to launch a 14 days lifestyle challenge. What is that? You know, I have written 3 books. This here, 14 Days to Amazing Health. 14 Days to Amazing Health has the keys that you can use to jumpstart your health and prevent diseases. You know, I had somebody ask me, hey, Dr. Cooper, do you really believe I can see changes in 14 days? And I said, of course, you can see changes in 14 days. Now, if you listen to the story of Chef Edgar joined our practice several months ago, maybe 4 months ago, and within 14 days, the chef told me that he lost 14 pounds. I really didn't believe him, but he did. He lost actually 15 pounds in 14 days. And that's the reason why we're jump-starting our 14 days lifestyle challenge. What are we offering? So we're going to prepare your meals, your breakfast, your lunch, and your dinner. You're going to purchase your meals from us, and the person who loses the most weight or improves the blood pressure or improve their blood sugar, the A1C, will receive $300. That's a big prize. The second winner, probably $100. So the biggest loser will receive $300 from us here. So if you're living in the Rio Grande Valley, then go to the website, www.gethealthwithdrcooper, and look there. Sign up for the 14 days challenge. The challenge will begin August 20th. But we're looking for about 50 people who will sign up because they want to change lifestyle and jumpstart their health to be a healthier person. Now you might be wondering, so if I'm living outside of the Rio Grande Valley, what should I do? Well, we are working on meal delivery. So sign up anyway, because we might be able to send your meal to your location, or you can call us. Call us and ask us what to do, because we want to be very inclusive. The idea is to reach out to as many people as we can so we can help you to become healthier. So what are we going to be discussing today? So today we're going to be discussing cardiovascular disease. And later on in my show, you will meet Dr. Pedro Mego. Dr. Mego is board certified in internal medicine and cardiovascular disease, as well as obesity. This guy is well prepared. So I want you now to start writing your questions down for Dr. Mego. Write them down and then post them. He's going to be on at about 6:30 or so. Post this question so that the doctor can help you. In the United States, every year, 650,000 people die from heart disease. Are you one of those who are at risk for heart disease? Well, if you don't know, then you need to stay on to the end of the show, because at the end of the show, you might learn that you're at risk or You probably have symptoms suggesting heart disease. So if you know anyone with heart disease, then send them the link and have them join us, because we're going to be giving you vital information on how to prevent the disease or how to take care of your heart. So don't go away, because we have a lot in store for you. So remember to like and share the page, and I'll be right back after the short break.
Ahora toca a nosotros cuidar de quienes nos ayudaron a crecer. El tiempo corre rápido para ellos. Es momento de pensar en los profesionales que con amor cuiden de sus días. La cuenta es regresiva. Polymer Hospice y Palliative Care son los indicados. Nuestros cuidados paliativos son confiables. El llamarnos puede ser una solución para la familia. Te entendemos bien. Descansa tu preocupación en nosotros. Somos Polymer Hospice and Palliative Care.
Hey, do you have high blood pressure, diabetes, hypertension, cancer? Well, come over to Cooper Wellness Center. We have raw organic juices filled with vitamins and antioxidants, good for any diseases. So come over to Cooper Wellness Center and ask for one of our juices, and we will serve you up something that will give you long, healthy life and help you to lose weight and get off your diabetes medication. Come to Cooper Wellness Center. Welcome. All right, so let me take the time to welcome some of you that have joined us. Clarissa Cáceres, thank you for watching. My cousin in England, I know it's very late at night. Leroy, you're always watching. Thank you so much. Dahlia Mackenzie, thank you. All righty. Elda, Jacinto Flores, Minnie Carnes, thank you so much. Miguel Dominguez, you're going to be a doctor soon. I want you to keep watching the show so you can be a lifestyle medicine doctor, Miguel. Tiffany, I want to welcome you. Flor, welcome. Mr. Griffith, I met you in New York during my stay there at the Health Expo. I thank you for joining. Edgar, my chef, you're always there. Thank you so much, Edgar. You're a great example. Thank you for watching. Rosita de Anda, thank you, welcome. Haciel, welcome. Dr. Diane Thompson, you're watching on YouTube. Thank you so much, Diane. And I'm looking forward to seeing your Facebook Live on Monday. Nora Maldonado, thank you. Leonel Dwyer, one of my friends from way back in Jamaica. Thank you so much for watching. Jesus Sánchez, hola, thank you, Jesus. Y si usted nomás habla español, vamos a tener el show también en español. Así que I want to welcome all of you that are joining. Remember that at about 6:30 or so, you're going to have Dr. Pedro Mego. He's board certified in cardiology. Please get your questions ready for him. My sister from Jamaica just joined, Marlene. I don't know if I'm seeing everyone, but I want to thank you so much for joining us. Welcome to the show. We are discussing cardiovascular disease, the #1 killer in the world. So I'd like you to like, share the page, and remember, get your questions ready for Dr. Pedro Mego. We're going to continue with our show right now. Welcome back to Get Health with Dr. Cooper. My name is Dr. Cooper-Dockery. I'm board certified in internal medicine, and I've been practicing for about 27 years. If you're just joining us, I have been discussing cardiovascular disease. Later on in the program, I'm going to be having a guest, Dr. Pedro Mego. He's board certified in cardiology, internal medicine, and obesity. So he's well versed to discuss the disease of heart disease. So if you're just joining us, I'd like you to like and share the page, call your friends, and tell them to tune in to Get Health with Dr. Cooper. This program is on every Sunday at 6 p.m. Central and 7 p.m. Eastern Standard Time. The goal of the program is to educate you on how to use lifestyle modification to improve your health, prevent disease, or reverse diseases. And I've had on my previous shows many patients who have come in and discussed how they have improved their blood sugar, got off medication, or improved different diseases just with tweaking their lifestyle. You know, it is said that genetics pull the trigger. Actually, genetics load the gun, but your lifestyle pulls the trigger. I know it is difficult to change lifestyle, but it's not impossible. And that is why I'm here to coach you along on how best to do it. So today we're discussing the #1 killer in the United States and around the world. Do you know that heart disease, cardiovascular disease, is the #1 killer for people in the United States or worldwide? So how many people die per year as a result of heart disease? Do you know that? Why don't you put it in the comment? And if you get it right, I'll send you one of my books. It could be 14 Days to Amazing Health or Incredibly Delicious Vegan, or it could be Get Healthy for Life. So how many people die per year as a result of cardiovascular disease in the United States? Go ahead and put that there. And then worldwide, how many people die per year globally as a result of heart disease? Go ahead and put that in. At the end of the show, I will tell you. So cardiovascular disease is a disease that we must attack. We must educate you about this disease so that you can protect yourself, protect the lives of your family and your friends. So what is cardiovascular disease? You know, I'm going to wait until Dr. Mego comes here so he can tell you what is cardiovascular disease. However, when we talk about cardiovascular, we're talking about cardio is heart. It's a huge muscle that works around the clock. Now, how many times does your heart beat? Tell me. Does it beat 50 times a minute, 80, 100? You know, I had a patient who came to my office last week. He was very dizzy. I looked at his medication and I realized he was taking 2 drugs that lower the heart rate. So I sat him down and I decreased the dose of one of the drug. I did his EKG, his electrocardiogram. His heart rate was 42 per minute. So the heart wasn't beating fast enough. Now, he's not an athlete. You know, athletes tend to have a lower heart rate because the heart has more endurance, the muscle is stronger and you know, beating with more force. But he was not one of those athletes. So then his heart was not pumping enough to give enough blood to the organs and to give enough oxygen, so he was a bit dizzy. So where are you with heart disease? Are you at risk? Who are at risk then for this disease that's taken so many lives in the world and in where you live? Who are at risk? You know, as one gets older, that person becomes at risk for almost all diseases. So age is a factor. Now, gender is a factor. We see more heart disease in males than in females. So if you're female, you're somewhat protected, but not really. What about genes, genetics? Yes. If you have a strong family history, your father or mother, brother or sister, you know, have had heart attack, then you probably are at risk as well. So these factors are not modifiable. That means you're at risk and you're at risk. However, lifestyle can help suppress the gene, can help delay the expression of the heart disease. Now, what are the modifiable risk factors? Well, diabetes, high blood pressure, smoking, obesity, inactivity, high cholesterol. These are risk factors that are modifiable. When I say modifiable, what do I mean though? It means you can take control. You can tweak the problem. So if you're diabetic, then you need to become controlled. You need to eat differently, exercise, make sure you're taking the medication that the doctor prescribes, and keep that hemoglobin A1C or that blood sugar low or normal. Then you're going to reduce your risk of developing heart disease. Cholesterol. You have high cholesterol though, there's only one food type that really will increase your cholesterol, and that is animal products. Meats and butter and milk and eggs, all those will increase your cholesterol and put you at risk for having blockage in the coronary arteries, and you can have heart disease. What about hypertension? There's so many factors that can lead to hypertension. Well, family history, stress, medication, obesity. So if you're hypertensive, you are at risk for a heart attack. You're at risk for enlarged heart and heart failure, but there's always hope. So therefore, what you need to do is to make sure you're following a healthy lifestyle. First of all, make sure you get checked to see what your blood pressure is. What is the normal blood pressure? Does anyone know? Put it in the comment. And if you have that right, then I will send you a gift. So get your blood pressure under control. If you do not exercise, if you like to sit all the time, then that will place you at risk for many diseases. As a matter of fact, it is believed that inactivity is the fourth leading cause of death. Yes, if you don't move, you're setting yourself up for early death. So you need to move. Now, if you have a very sedentary job, it's very easy to exercise at your desk. Now, have you ever heard about active sitting actively? Well, you sit back with your shoulder high. You're going to contract your abdominals and the gluteus. You're going to put your feet flat on the floor. You're going to tense those quads. All right? That is active sitting. You are exercising. Now, if you answer the phone a lot, you get up and you walk around as you're answering the phone. You don't have to sit at your desk. So I don't like the excuse when my patients say, hey, doc, I don't have time to exercise. I'll tell them, all right, active sitting, or just get up in the mornings, do your exercise in the mornings, or, use the stairs, the common things that we all know. So inactivity is the next smoking. So you should not sit for any prolonged time beyond 3 hours. Then you're increasing your risk for death and heart disease. Now, as I mentioned, if you're just joining us, the main focus of the show today is cardiovascular disease. And our guest is Dr. Pedro Mego, board certified in cardiovascular disease, as well as obesity. So he has a lot in store for you. So I'd like you to like the page, share the information, make comments for Dr. Mego to answer. Put your questions there, and he's going to answer when he gets on the show later on as we continue. So don't go away. I'm going to take a short break. I'll be right back.
Now it's our turn to take care of those who saw and helped us grow. Their time is valuable. It is time to think of a professional staff who will help take care of them. We at PalliMed Hospice and Palliative Care are the right choice. Our staff and 24/7 services are trusted and reliable. Call us. We are the solution you and your family need. We understand you. We are PalliMed Hospice and Palliative Care.
Hey, do you have high blood pressure, diabetes, hypertension, cancer? Well, come over to Cooper Wellness Center. We have raw organic juices filled with vitamins and antioxidants, good for any diseases. So come over to Cooper Wellness Center and ask for one of our juices, and we will serve you up something that will give you long, healthy life and help you to lose weight and get off your diabetes medication. Come to Cooper Wellness Center.
Hello, my name is Freddy Peralta, and I just want to share with you something that changed my life in 4 months. For about 30 years, I was taking blood pressure medicine every day, every morning, and then I decided I need a change of my life, and I came in contact with Dr. Cooper, and from that moment, everything changed. How I changed? It changed very easily. You know, I start a program and where they talk about nutrition, when they teach you about food, and they do demonstration about how you can cook healthy food in your house and how can you prepare, you know, food as a medicine. Then after that, you know, start doing exercise with a focus. Then the center start not only doing demonstration about food, but also selling foods. And then I started eating the food that I prepare over here. Then it came the juices, and because every juice is focused on a specific healthy problem, so I started looking for juices about blood pressure, like hibiscus, the bees, and something like that. So what I need to tell you that in 4 months I changed my life. You know, I did it. It wasn't something spectacular. It was something simple. You know, I did it. You can do it. It's very simple. Change your lifestyle.
Welcome back. You are watching Get Health with Dr. Cooper, and our topic today is cardiovascular disease. Let me take the time to welcome some people who have joined us. I have some family members here. My cousin Norma. Welcome, Norma. I have Rella. Welcome. My daughter Donnell, Curtis, Brooks, you're always there. Roberto, Rosalinda, I want to welcome you. The program today is very interesting. We're discussing the #1 killer, which is cardiovascular disease. Why is it the #1 killer? And how can you prevent this disease? Remember, this program is to empower you to be healthy, to prevent diseases, or to improve the diseases that you have. I had asked what's the normal blood pressure, and Clarissa is saying it's 80/100. Clarissa, that is not so right. Somebody else answered 120/80. Yes, this is right. Guys, I want to apologize for my voice. I have been having a lot of allergies this week. You know, in the Rio Grande Valley here, we're prone to allergies, and that got me. You know, this week I was seeing a patient, and I had to leave the room. I had a cough attack. So I'm doing well right now. So I want you to like and share our page, and we're waiting for Dr. Mego to arrive. Dr. Pedro Mego is board certified in cardiovascular disease. He's board certified in obesity. He has a lot of information for you today. So what I want you to do is to share the page. Put your questions here. Put your comments. If you don't want to die from heart disease, then ask your questions. We're here to empower you to live a healthy and happy life for the rest of your life. So we're going to take a short break while I get ready to bring Dr. Mego on the stage for you to ask all your questions. We'll be right back.
Hello everybody, how you doing? Chef Edgar here from the Cooper Wellness Center. I just want to give you a little insight to what's been going on here at the Cooper Wellness Center for the past month. If you haven't heard, you've probably seen I've lost weight, 15 pounds and more. How did I do that? Very easy. Meal preps. and juices. Why waste your time cooking every single day when you could get the meals here? They're ready to go, they're nutritious, and the juices are fantastic. That's my secret to losing weight. I do my walking, I do my running, but my meal preps, I get the vitamins I need the nutrition I need, and they fill me up. That's how I've been losing weight. Quick. In 1 month, 15 pounds. They might say that's a little extreme, but my body was extreme. But now I've been losing 15 pounds and more, and I love it. Why? I've told my wife, I've even become a little bit more flexible. I could touch my toes now. Before, when I was eating all that junk food, all that fats, I wasn't very flexible. I had a hard time breathing, I had a hard time putting on my clothes. Now, I feel like brand new. I want you to try the same thing as well. Why? Because it's better for you. It's a very healthier life for you. And you gotta try it out. Come to the Cooper Wellness Center. You'll enjoy it. The juices are fantastic. They're fresh. They're made every day. You gotta come quick because everybody's coming and buying them. They're flying off the shelves. Our meals, they're made fresh. If you want them warm and hot, call us and we'll have it ready for you. But here at the Cooper Wellness Center, that's what we focus on. Lifestyle, changing everything, and using food as medicine. So I'll be here, Chef Edgar. We'll be here to answer any questions you have. I lost all this weight. I want you to lose it as well. Now I had to buy new clothes, and that's perfect with me. If I don't have to buy larger clothes, that's okay. I went from a extra large, I'm back to a medium, and I want you to do it as well.
Welcome back to Get Healthy with Dr. Cooper. We're discussing cardiovascular disease, and I want to take the time to welcome some people who have just joined. My name is Dr. Cooper-Dockery. I'm board certified in internal medicine, and I've been practicing medicine for over 27 years. Over the last several years, I myself changed my lifestyle, lost 25 pounds, improved my health, and I have been doing the same with my patients. I have many patients who have improved their health, gotten off medication, reversed their diabetes, lost weight, and are doing well. I want to promote our 14 days lifestyle challenge to all of you, especially those of you who are in the Rio Grande Valley. Go to my website, www.cooperwellnesscenter.com, and you see the information there. Let me welcome Joan Gordon, watching from New York, Pauline Wells from the Bahamas, my cousin. Hello, Rose, you're always there watching us. I want to welcome all of you again. And, you know, I gave the challenge asking, what is a normal blood pressure? If you don't know that, then you need to check because you probably have high blood pressure. And high blood pressure is a risk factor for heart disease. As I mentioned earlier on, millions of people are dying per year as a result of heart disease. Now, how do you know if you have heart disease? What are some of the symptoms for heart disease? How do you know if you're having a heart attack? There are many times patients will come into the office and say, hey, doctor, I have numbness in my fingers, I have numbness here. Am I having a stroke or am I having a heart attack? So how do you know if you are having symptoms suggesting of heart disease? Well, chest pain. Chest pain is a very frequent one. Walking up a flight of stairs and you probably have some pressure in your chest, or if you're getting short of breath, you're having difficulty breathing while you're going up the flight of stairs. Now, this could indicate that enough blood is not getting to the heart muscle because of some obstruction. So if you're having that symptoms, you also need to speak with your doctor. Now, what about having sweating and flushing? You're sweating, you're walking, and you're short of breath, your heart is beating fast, and you probably are sweating. That's something you should also discuss with your doctor. All right? So you have high blood pressure for many years, and you're laying down at night, and you have to be using 2 or 3 pillows. Could that indicate that you're having heart disease? Heart failure, yes. If you're laying and you have to sit up, or use 2 or 3 pillows, this could mean that your heart is not functioning well. Now, high blood pressure can put pressure on the left side of the heart. The left side of the heart is going to grow, the muscles will become more, the heart becomes enlarged, trying to get over that blood pressure, to pump blood beyond that point. The heart will probably become weakened, dilate, and that could give you heart disease. When we talk about cardiovascular disease, we're talking about disease of the muscle, disease of the heart itself, and disease of the vessel. And I mentioned to you that each year in the United States, about 460,000 people die per year as a result of heart attack. What is a heart attack? Now, I'm sure you've heard myocardial infarct, heart attack. What is it? Now, your heart is a muscle. And in order for that muscle to stay healthy, enough blood needs to get to that muscle. If enough blood is not pumping to that muscle, then what happens is that the heart will, that area of the heart will become ischemic. And therefore, you can have pain or you can even die if a large area is not irrigated. So stay tuned. Dr. Mego is on his way, so get all your questions out, and he's going to be giving you all the answers you need. So get your questions together. We'll be right back. Hello, everyone. I'm Dr. Cooper-Dockery, board certified in internal medicine. I have been practicing medicine for about 27 years. Most of the time, I have practiced the traditional way, medication and medication, medication. However, despite all these fantastic drugs and great medicine, patients continue to die from their diseases or having complications, not because the drugs were not good, but we miss something very important. Many centuries ago, Hippocrates, the father of medicine, said, "Let food be your medicine, medicine be your food." So I have changed my emphasis several years ago using food as medicine. At Cooper Wellness Center, we have now established a whole nutrition project where we have healthy organic meals, healthy organic juices. I want to welcome Chef Edgar, Executive Chef. Why don't you walk onto the stage here, Chef? How are you doing, Chef? Good, good.
Hello, everybody.
Tell them what we're doing here at Cooper Wellness Center.
Here at Cooper Wellness Center, we're doing amazing things and we're seeing amazing results. We're doing our meal preps, organic, fresh, delicious, and we're doing our juices, raw, organic, and fresh.
Nothing added, no sugar added.
No sugars, no water, all fruits and vegetables.
All natural. And we have specially blended these juices for specific diseases. So we want to reach out to you today. If you're sick and tired of medication, if you're sick and tired of doing everything the doctor says, but you're still not well, then where should they come?
They should come to the Cooper Wellness Center. It's amazing. We're seeing results. We're seeing patients get rid of their pills. And why? They're trading in for a juice.
That's right. So if you're living in the Rio Grande Valley, then you can find us at 3604 North McCall Road. You can also find us online at cooperwellnesscenter.com. You can even order your meals online. And we have lots of packages.
A lot of packages. You have to take advantage of these packages. You want meals, you want juices, you want protein balls, you want snacks. They're here at the Cooper Wellness Center. Everything is organic, everything is fresh. You have to come and try them out.
And doctor approved.
Yes, they are.
Specially made by the chefs to listen. We're here to let you feel better and live a longer life. So don't hesitate to find us, to walk over. The chef will cook you up hot meals if you want to have hot meals. And we are also catering.
Yes, we are. We're catering. We have different foods that we can cater. If you have an event and say, you know what, I'm tired of this fatty food, call us, get ready, and we'll set up an appointment and we'll be there catering your event.
So let food be your medicine. See us here at Cooper Wellness Center. Welcome back to Get Health with Dr. Cooper. We have been waiting for Dr. Pedro Mego. As I told, he's board certified in cardiology as well as obesity. So he is an expert in these topics. So we have been discussing cardiovascular disease. Dr. Mego, welcome.
Thank you, Dona.
Good. Why don't you tell us about yourself, where you practice, where you're from?
I am originally from Peru. I did medical school back there, and then I trained in New York for medicine and in Arkansas for cardiology and for interventional cardiology before coming to practice here in South Texas. And since I finished my interventional cardiology program, I have been practicing here in South Texas in McAllen in private practice. It's a busy like probably we all know, South Texas is high incidence in obesity, diabetes, and you can conclude that CAD and peripheral artery disease is a very high prevalence in this area. That means it's a busy practice.
That's right. I know you're very busy. As you mentioned, we have a lot of diabetes here, a lot of hypertension, a lot of obesity. All these are risk factors for heart disease. Now, when we talk about cardiovascular disease, what is cardiovascular disease?
In summary, coronary artery disease, this is the main cardiovascular disease, is also known as ischemic heart disease. To make it a little simple, we all know that the heart has a pump, that the body has a pump, that's the heart. The heart function is to mobilize all this blood through the arteries to the body, supplying good oxygen, good nutrients through the arteries to the body, and then picking up this blood from the body to the heart full of CO2 and waste. That is the normal circulation. The heart per se also has their own circulation. The heart has his own arteries as well as his own vein system. But when these arteries of the heart, that is called coronary arteries, gets obstructed, it's called coronary artery disease, or we call it ischemic heart disease. Basically, it's the obstruction of the arteries to the heart itself, that having obstruction, the heart muscle is not going to receive enough blood and is going to suffer. That suffering, we call it ischemia, and that is what is basically coronary artery disease.
That's right. So our listeners who are out there listening to you, they probably are thinking, am I at risk for this disease? Who are at risk for coronary artery disease?
Yeah, unfortunately, a lot of us we are, no? And probably also people could know that coronary artery disease is the #1 cause of death in America and in the whole world.
That's right.
No? Risk factors basically are diabetes, hypertension, hyperlipidemia, smoking, age, hereditary factors, obesity are the main risk factors for coronary artery disease. No? And the more that we have, more risk that we have to develop.
That's right, that's right. So the patient's probably thinking, okay, my father had heart disease, so I must be at risk. Now, are there symptoms that we'll tell the patients to look out for? What are the symptoms that could indicate coronary artery disease?
Coronary artery disease can be described as a stage. No? When it's an early stage, we are asymptomatic. We are this obstruction that is called atherosclerosis. No? It's construction of this cholesterol plaque with a lot of components, inflammatory markers in the arteries. When it's in the mild stage or even the moderate stage, we are asymptomatics. We don't feel anything. That means that this plaque is been forming even in young age, young adults. And at 40 years of age, a lot of people we have it. No?
That's right.
But the patient becomes more symptomatic when this becomes moderate or severe, or when something acute happens. Yeah, and the symptoms, mainly the symptoms that we can directly relate it to coronary artery disease is chest pain. That's the typical chest pain, exercise-induced. For me, I usually try to, when I talk to the patient, I try to see how much exercise they do.
Right.
You know? Because a lot of people say, I don't have chest pain. I say, when is the last time that you play basketball or you play soccer? Oh, doctor, like 5 years ago.
Yeah, they just sit.
Exactly. Most of us, we have a very sedentary life.
Right.
And, or at least if you before was able to walk a mile and now walks 2 blocks and gets short of breath or chest pain, that is a significant concern and symptom that could be related to coronary artery disease.
But there are also other symptoms that are really not chest pain. What about the person who has diabetes or high blood pressure? Now they're going up the stairs and they're just short of breath. Should that also indicate that there might be some coronary artery disease?
Absolutely, yes. No, there is something that is called ischemic equivalent, or angina equivalent. Shortness of breath is one of them. It's a symptom that the same, before was used to walk 5 blocks, no problem. Now walking 1 or 2 blocks gets shortness of breath.
Right.
That could be a symptom, very high alert for coronary artery disease. Or sometimes even having no symptoms, but having risk factors put equivalent to coronary artery disease. That is something that people don't know. But for example, somebody having diabetes that is not well controlled for 5 years, it's exactly the same risk that somebody already had a heart attack.
That's right.
In that way, it is, risk factors are very important in this condition.
Right. So therefore, diabetes, I know that in my practice, if somebody has diabetes, I immediately treat that patient as though they've had heart disease, right?
It is very true. And we do the same. That is why the current recommendations for coronary artery disease and diabetes are very similar.
Very similar.
Very similar. Cholesterol target, blood pressure target goals are very, very similar.
Very good. Doctor, so how do we make the diagnosis?
Coronary artery disease, I would say, goes by severity. No? Some of us, we can have coronary artery disease and we don't have symptoms. If we want to make a diagnosis per se, probably it is important to do a test to evaluate for that. The test goes from non-invasive, no? like a stress test is the most common test that your doctor can do in the office. For that, there is a standardized protocol that we walk. We make the patient walk in a treadmill machine or in a bicycle, or if somebody cannot walk, we induce this exercise with the medication, and with that we can see some EKG changes, or if the patient cannot walk, we take a picture with a nuclear camera to see defects, we call ischemia, in this testing.
Very good.
Yeah, there is another technology also that we can do similar with an ultrasound, or another technology is called coronary CT scan, where it's a CAT scan that checks for coronary circulation and also can check for calcium score in the same test.
Right, right. What if the patient has a positive CT of the heart?
Basically, like anything in medicine, I go for both. I go for symptoms and evidence of the patient could have this coronary artery disease. Symptoms, we talk about chest pain, shortness of breath, reduction of functional capacity, unable to perform normal living activities. That is one component associated with risk factors, diabetes, family risk, cholesterol, blood pressure, overweight, and also if the patient has an abnormal stress test, a normal CAT scan, abnormal nuclear stress test. If both of them correlate, it is, and in all this process, we are going to be already treating it, no? With lifestyle modification, improving diet, controlling diabetes, blood pressure, cholesterol. And if these symptoms persist, is when we, in general, recommend an invasive testing that is a confirmatory testing and also a therapeutic, because we can provide therapy, we can treat the lesion through an invasive procedure.
I like what you just said, doctor. You said that the patient is positive, you start with lifestyle modification.
Absolutely.
I think our audience need to know that we don't just give medication just for medication, but we have to teach the patient how to change lifestyle. Because we know that the #1 risk factor for chronic diseases is actually the food and the lifestyle. So I know you're very big on lifestyle. You help patients lose weight and become healthier. And we have similar goals.
Absolutely.
All right, before you continue, doctor, let me just take time to just welcome some people who are watching us. Monica Gonzalez, welcome. Sharon, Margaret Cooper, Latoya, my cousin, Lionel, Freddie Peralta, all of you, Jerry Tamayo, Nana, I just want to welcome you. The topic today is quite interesting. We're discussing the #1 killer in the world. As I mentioned earlier on, that worldwide, 17 million people die yearly as a result of cardiovascular disease. And in the United States, over 610,000 people die. So I have Dr. Pedro Mego here, who's an expert in cardiology, to discuss some of these problems of how to prevent the disease. How can you protect yourself? Doctor, at what time would you suggest that a patient goes to the hospital, to the ER?
Most of the patients that goes to the ER goes for decompensation of a condition. No? When we go in coronary artery disease, there are some symptoms what we call stable and other symptoms that we call unstable. A stable angina is basically the pain that happens at rest, before progressively. No? Before I was able to walk 5 blocks with no problems. Now I feel a little chest pain. Now 2 blocks producing chest pain. Now half a block chest pain. That is a stable, progressive disease. Unstable angina is when something happens suddenly.
Right.
No? I was able to walk a mile a week ago, and now chest pain walking half a block. That is something very bad. Or chest pain at rest, or chest pain that woke me up in the middle of the night, or shortness of breath unexplained. No? That is something unexpected. If something unexpected or acute decompensation or acute worsening happen, is when obviously the patient should go to the emergency room and we need to treat it as an inpatient.
That's right.
If it is something progressive, most of the time we do the workup as outpatient basis in the office, and we can give significant recommendations that could avoid to get decompensated and go to the hospital for this reason.
Very good. All right, doctor, let's spend most of our time now talking about prevention, because that's what I like. I want to stop the disease before it comes to us, really. So tell me, doctor, how do you advise your patient so they can prevent this disease?
There is a standard recommendations for coronary artery disease, and basically I divide it in 3. Basically, one is lifestyle prevention, no? What it means improve your diet, avoid overweight. The other part is to treat the underlying problem, no? Diabetes, hypertension, hyperlipidemia. And there is one part that is called antiplatelets. No? And 3 of them usually is being provided. No? If the patient has some overweight, please work on that. If the patient has already obesity, work more on that. Morbid obesity, obviously, we need to work even more on
Yes.
that. And progressively exercise, we recommend 30 minutes of walking 4 or 5 times a week.
That's right.
Or some degree of physical activities. In diabetes, there is the recommendations for somebody with diabetes is, as we mentioned, as the same severity or the same strength, trying to control the cholesterol, the blood pressure with the current recommendation. And most of these patients will require antiplatelet therapy, you know, aspirin. For anyone basically older than 65 or having 2 of the risk factors that we mentioned before, is recommended antiplatelet therapy.
Excellent. Let me take the time to welcome some people. Claire Gordon, Donnell, my daughter, Hillary Griffin from Washington, or Hillary Griffin, Washington, welcome. Minerva Clinton Porter from New York. We grew up together in Jamaica, welcome. You were asking about blood sugar as high as 212, that is high. If you have that sugar, you need to see your doctor. I want to welcome all of you who have just joined us. We are discussing cardiovascular disease, and we like to emphasize prevention. Dr. Mega just discussed lifestyle. And lifestyle is a complex of habits. So healthier nutrition, exercise at least 30 minutes every day, 6 days a week. Of course, getting enough rest, losing weight if you're overweight, and then get to the diseases that are going to increase your risk for heart disease, like diabetes, managing the sugar well, high blood pressure, controlling that, high cholesterol. Remember, I always discuss that the only foods that contain cholesterol are animal products. So you need to watch the amount of animal protein that you consume and consume mostly a plant-based meal. And then he discussed antiplatelets. Why is it that they should be on antiplatelet therapy?
Antiplatelets when we were talking about a stable and an unstable condition, is something that we call unstable plaque. This cholesterol plaque that has been forming for years, for some reason, some stress, smoking, inflammatory process, it can rupture.
Right.
And in this rupture, the body will feel that something that shouldn't be there is in the arteries, and the artery will respond producing a clot, trying to limit this abnormal tissue in the artery, and this clot can obstruct the artery.
Right.
Obstructing the artery produces something that is stable in unstable, because now the artery is not more 30% obstruction, now it's 80, 90, or 100% obstruction. If it is 100% obstruction, it's already called a heart attack.
Right.
You know, in that way, giving this antiplatelet therapy will reduce this plaque formation, this thrombus formation.
Right.
And it has been shown that simple aspirin once a day reduces approximately 33% chances of a stroke and heart attack, because the stroke is the same process but in the brain.
That's right.
The heart attack is the process in the heart.
In the heart.
And basically, that is why antiplatelets is highly recommended.
Right, right. So to keep the blood thinner and to prevent clot formation. Dr. Mego, it's a pleasure having you. And I'm sure I'm going to have you again on the show, because you are filled with knowledge. And our patients need the knowledge, or our viewers actually need the knowledge, so you can stay healthy. Remember to join us every Sunday at 6 p.m. Central, same place, so you can be informed on how you can prevent, improve, or treat diseases. Doctor, thank you so much for coming.
My pleasure to be here.
We'll see you again next week.